Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope and Natural Health podcast, where I try to get you healthy the right way. Last week, episode 45, we talked all about PMDD versus PMS. So if you want to know what I'm chatting about there, go back and listen. But this week, we're going to be talking about menorrhagia, or heavy flow in more layman's terms. So what is menorrhagia? It's actually really an ICD-10 code, which is a diagnosis code of excessive menstruation or prolonged bleeding that can last more than 7 days on your menstrual cycle. So the big question is, how do you know if your menstrual cycle is heavy? Well, the reason I'm doing this podcast is because at the time of recording, I have recently feel like I've broken TikTok with a view on a stitch that I did with someone else about leaking. And the point of the TikTok was to explain that if you have such a heavy period that you are checking the seat or afraid that you might leak, we've got a problem. This likely is menorrhagia or heavy flow. Also, if you are not able to change, like you might leak, obviously there's things that are out of our control, like you're stuck in class for a long time, or you can't go to the bathroom, or perhaps your pad shifts. Like there's other reasons for it leaking. But the point of my TikTok was to really explain heavy menstrual flow. Also, if you're having to change your tampon or pad less than 2 hours in between, this is also likely heavy bleeding. So it's one of the most common problems that women report to their doctors. And it's estimated that over 10 million American women suffer from this every single year. And that means like 1 out of 5 of you have menorrhagia. So it's super, super common, but it's also something that it is reported to doctors, but also women don't really know that they can get help for it. And that's what I advocate so much for about period problems, is that a lot of these period problems have been normalized. And a lot of women don't think that they can get the support or the help that they need, or even the diagnosis as to the why. So others really don't go get help because maybe they're too embarrassed to talk about it. And I've seen a lot of this commented through TikTok in the comments too. So making sure that you speak openly and say, hey, is this normal? I don't find that it's normal, or I just wanted to know if it is normal, or something that you should have the conversation with your doctor. So let's talk about the normalcies about what a regular menstrual cycle looks like. So during your period, the normal amount of blood that you lost is about 5 milliliters to 80 milliliters. So anywhere in between there is normal. Now, to put this into perspective, a regular tampon will hold up to 5 milliliters of blood. So if you're using regular tampons, you would literally have to blow through 16 of them to get to the 80 plus milliliters of blood to make this an abnormal bleeding cycle. But if you're using super tampons, these hold 10 milliliters of menstrual fluid. So then you might be blowing through these, and that's like, if you're changing every hour, you're already hitting that max amount in the first day of your cycle. Remember, this is the entire menstrual cycle. So, anywhere from 3 to 5 days on average, but also heavy bleeding or menorrhagia is, determined if we're bleeding more than 7 days too. So keep that in mind. And then if you're using a menstrual cup, these hold about 30 to 60 milliliters. So if you're having to change that 2 or 3 times, which I have heard in the comments of this TikTok, like women are having to change very, very often, like none of this is normal. We should not be bleeding this heavy. So why could this happen? Well, it could be a very myriad of reasons. And this is where naturopathically, I like to find the root cause instead of just giving a Band-Aid or just being like, oh, I guess that's the way it is, which a lot of these women have been told that it's just normal and that's just how it is. Their uterus isn't happy. But common causes could be a hormone imbalance. We might have a lot of estrogen and very little progesterone. If we're not ovulating, which is another podcast coming up, we will be making progesterone, and progesterone really influences our menstrual cycle. So it could very well be something going on with your reproductive hormones. It could be an underactive thyroid. I see thyroid disease almost every single day. So if your thyroid is on the underactive side, this definitely influences your period flow. It could be stress or inflammation. Now, it doesn't have to be one of these reasons. It can be a combination of a couple or even all of them that are causing this heavy flow. The IUD actually can cause heavy periods, specifically the copper one. The hormonal ones like Mirena or Kyleena, these ones typically will really stop your period, but copper IUDs have been reported to cause heavier bleeding than you actually started with. And this is due to vascular changes from the IUD that regulate our blood flow to our uterus. So that's kind of why possibly you might have a heavier period if you have an IUD insertion. So those are some of the common causes. It could also be cysts, it could be fibroids, it could be PCOS, it could be endometriosis, it could be adenomyosis. It could be a myriad of things causing this heavy flow. But the goal of this is to really let you know that if you have heavy flow, let's find the answer, let's find the why, because your period should not be miserable. If you are having flow to the point where it's disrupting your life, this is not okay. Like I preach almost every single day, your period should come and go. It should literally just be more of a nuisance than anything, and it should not disrupt your life. So keep that in mind. Now, if we have this flow problem, so if you're common things about the flow, not necessarily just changing, every 2 hours, which is the big one, or less than 2 hours. I've heard anywhere from 5 minutes to 30 minutes or just soaking through products. If you're passing clots that are larger than a quarter, that is also a sign of abnormal menstrual flow. If you're having to double up on your products, I've heard the tampad, which means you wear a tampon and a pad to really soak up the flow. This is not normal. Or doubling up on your pad, so you have to wear 2 pads. I've even heard of women on TikTok in these comments talk about wearing adult diapers. Like, this is not normal. Having to restrict your daily activities due to a possible oops, like you're terrified to leave the house. I've heard women that they've had blood dripping down their leg. They won't leave the house. They're too embarrassed. You name it. I think everything has been commented on the TikTok comments on this video I stitched. Also, if you're having to carry up back up underwear or clothes, if you're having to change your sheets, like this is not normal. This means your flow is too heavy, and there likely is a reason. There are some people that are wanting to, argue with me on TikTok and saying that, well, that's just the way it is, and some flows are just heavy, and there's something going on. So I want you to be an advocate for your own health and really try and figure out why this is happening to you, because we should not be losing this amount of blood. And the reason is because so many women too have also commented on TikTok that they've been told they're anemic. Being anemic is not normal either. And this is likely due to too much blood loss. So signs of anemia can be fatigue, you might have shortness of breath, you might have dizziness, hair loss, like iron deficiency is a big cause of heavy flow. So, not to scare anyone out there, it is more for education around heavy menstrual flow, because terrible periods have been normalized for so long, and that is what I love teaching and advocating for, is that understanding your own body and knowing when things are normal and when they're abnormal. And so many women don't even know that it's abnormal until it's been pointed out. And that's another realization that's come over in TikTok, is that, wait, this isn't normal. This is me. This has been happening to me. What can I do? So all of these things that I mentioned, like we've got to get lab work done. We might need imaging done. We might need, a pelvic exam, things like that, maybe a pap smear. All of these things can be done to really get to the root cause of what's going on. And know, too, that birth control is not the only option. Surgery is not the only option. These are options, but they aren't the only option. So keep that in mind if you've been told that is really your only cure to this heavy bleeding. So hopefully you learned something. I would love to know if this is you, if you are, surprised by hearing this, because I apparently have really shocked the world with, leaking and that it's not normal. So if I'm speaking to you, I would love to hear what's going on with your menstrual cycle and how we can troubleshoot what is going on. But hopefully you learned something. And if you did, share it with a friend. And I look forward to seeing you all next week.